There is a critical health issue that affects millions of Americans, chronic kidney disease, also known as CKD. More than 35 million US adults are living with CKD, yet 90% don't even know they have it. And for people with type 2 diabetes or high blood pressure, the risks are even higher. Dr. Charles Vega is a primary care physician and director of UC Irvine's program in medical education for the Latino community. And Thelma is a patient, a two-time kidney transplant recipient, to tell us about her journey to help others take charge of their health. Good morning, Dr. Vega and Thelma. Good to have you both on.
Good morning.
Thanks for having us.
You bet. And I always say up front, whenever I have a medical issue connected with the interview, I have only one kidney. I had to have one removed about 15 years ago, and I live with one kidney. So I'm always very conscious of everything I do for my kidney. So I'm with you on many
That's
levels
great.
about this conversation. So let's talk first about what chronic kidney disease is, Dr. Vega. Let's explain that and how it can impact so many aspects of our health.
Yeah, it's a great point. So chronic kidney disease, or CKD, is a chronic dysfunction of the kidneys. And remember, the kidneys act as the main filter for your blood. Unfortunately, when you have CKD, you're not only at risk for complications of kidney disease like transplant or dialysis, but cardiovascular events like heart attack or stroke as well. Yet many people, as you said, don't recognize CKD because it initiates without a lot of symptoms. And so therefore, it's very important to get screened if you have high-risk conditions.
And also, doesn't kidney disease can impact your blood pressure as well, correct, in terms of your kidney health?
It's a two-way street, absolutely. So as your kidney disease grows and gets worse, your blood pressure can be worse, but blood pressure in and of itself, hypertension is the most common risk factor for kidney disease. Hypertension affects about 45% of US adults.
I didn't know it was that high. That's scary to think of. Who is
It
most
is.
at risk too, and why is testing so important?
So there's hypertension and diabetes that account for about 2/3 of cases of CKD, but that means a third are not accounted for by hypertension and diabetes. So if you have a family history of kidney disease, if you have cardiovascular disease, you really need to get two tests done for screening, a blood test and a urine test. So it takes two tests to appropriately screen for chronic kidney disease, and then you and your clinician can initiate treatment that can reduce your risk over time.
So now there are two tests. Perfect. We're going to talk about this. Good segue. We have the It Takes Two initiative. What should patients know about the EGFR blood test and the UACR urine test?
Well, I think that really patients should advocate for getting both a blood and urine test. Those acronyms are kind of challenging, right? It's hard to remember, but just say blood test, urine test. If you have one of those high-risk conditions, it takes two folks. It takes you and your clinician, and it takes two tests, a blood and a urine test, to appropriately identify CKD.
And we have Thelma so patiently sitting there. Sorry to make it so long before we got to you, Thelma. How did you find out you had CKD?
Well, Ken, it took nearly a decade before I realized that I had chronic kidney disease. Oftentimes, when you present like I did with fatigue and swelling, the doctors push those symptoms off to another condition. But when I finally was diagnosed, everything spiraled out of control. I had type 2 diabetes, high blood pressure, high cholesterol, and that all living with CKD can be very overwhelming. And so basically, chronic kidney disease is a very interconnected condition, and it's called the cardiovascular kidney metabolic conditions that I'm living with, along with CKD. So life for me has been overwhelming, but I'm blessed.
Amen. Amen to that. Good to see you healthy and sitting there right now because you did something about it and you talked to your doctors and you're now an advocate for others, right? Facing kidney disease. So what advice do you have for people who may be at risk?
My advice to anyone who's at risk for CKD, please partner with your doctor. That's why we're talking about this campaign, It Takes Two, because it takes you and your doctor, the two tests, the urine test and the blood test, not only for kidney disease awareness, but also you can get an idea of what's happening with your kidneys from a cardiovascular risk management. Also, please go to testyourkidneys.com. What we need you to do is to be an advocate for your health. Empower yourselves to know what's happening in your body because knowledge is this power. And if we have the information, wisdom is that I've been through it so that you don't have to go through it. Please get your kidneys checked, partner with your doctor because it takes two tests, to you and your provider and to your care partners, because we want you all to be well, but we want you to be aware of what chronic kidney disease can do, not only to your kidneys, but also to your heart.
Right. And be good friends with your doctor, and then you won't have to meet up with the second doctor like me and Thelma in terms of like a nephrologist who is a kidney specialist if you take care of your kidneys up front. Not that my nephrologist isn't a nice guy, but at the same time, you want to not get to that point. So, Dr. Vega, what do people need to know about protecting their kidneys? And we're in the last 30 seconds.
Sure. So I want to thank Thelma for her story and sharing it so bravely. But I also want to thank Boehringer Ingelheim and Eli Lilly, who's partnering in this Test Your Kidneys campaign. So testyourkidneys.com is a great website, has a lot of resources so you can better advocate for yourselves. And just be aware of this and talk to your clinicians.
Excellent advice, both of you. Primary care physician Dr. Charles Vega, director of UC Irvine's program in medical education for the Latino community, and kidney patient and transplant recipient Thelma. Thank you both for coming on this morning. Great advice, and may you both be healthy and happy Thanksgiving.
Thank you.
Thank you. You too.